The cohesive implants we use today are different than the implants of the past. Old-fashioned, antique implants were a silicone shell filled with a liquid silicone oil, later filled with salt water. The saline implants are the heavier water-filled. Silicone were typically a liquid. Several generations later, the silicone implants were filled with a thick silicone pudding. But the modern implants we use today when we place implants, these cohesive implants are like a gel, like a gummy bear. The Allergan implant, smooth implant, it's been out for a while. The Allergan implant is a cohesive gel that has a smooth shell. Okay, so this is not a shell that causes that chronic irritation in the pocket. It's typically placed under the muscle. The gel inside is cohesive, although it's soft. It's actually a soft solid. So eventually, if the outer shell breaks down 20 years from now, the gel inside stays together. The Motiva breast implant is a cohesive implant containing a newer gel, also cohesive. Comes in a thick gel or a thin gel. The thinner gel is still soft like Jell-O. The top with this implant then gives that tapered look that's so natural. But what I love about it is this surface has a cobblestone-like appearance, which is smooth, but it's been studied and shown to be less irritating and less reactive in the tissue. In fact, it does so well that we're able to safely put it on top of the muscle. I place it under the muscle fascia, but on top of the muscle. The reason that's so awesome is, first of all, you're not cutting through muscle to make pretty breasts, because, hey, that muscle, your pec, it wasn't designed to become a bra. It is actually for shoulder stability and strength. So when we place this implant on top of the muscle, we get the beneficial biology of the muscle fascia creating a nice soft scar pocket, but the non-reactivity of this surface so that we don't get those tight pockets around the implant. To top it off, to keep it even safer, I rinse the pocket with a chlorinated fluid, which, a little bit like pool shock, it's a chlorinated salt water that destroys breast bacteria and breaks down to salt water within about 80 minutes. And that eliminates any possible contamination of breast gland bacteria getting on the implant. And those were the main causes in the past of capsular contracture. So, love these implants by Motiva. Love these implants by Allergan. Check out our implant composition video. You can see that down the way. I'd like to talk to you more about what's inside of these implants.